The purpose of this video is to discuss weight loss surgery, to discuss the weight management program at the Wyoming Medical Center, and then also to go over the disease of obesity and the health effects that it causes. I'm actually a Wyoming native. I grew up right here in Casper, Wyoming after being born in Laramie. Did my medical school training at the University of Washington, completed a general surgery residency at Stanford, after which I became a board-certified general surgeon. And then I decided to do extra training in the form of a fellowship in advanced laparoscopic and weight loss surgery at Harvard Medical School, where I was on the clinical faculty as a clinical instructor at the medical school. After that, I came back to Casper to start the bariatric surgery program, and I've been the medical director of weight loss surgery at Wyoming Medical Center since 2015. In the 4 years that we've had a weight loss surgery program at the Wyoming Medical Center, we've accomplished quite a bit. We are the state's only accredited weight loss surgery program with a comprehensive designation, which basically means that we've met all of the most rigorous standards of patient outcomes and safety. And I'm proud to say that we're the only program in the state of Wyoming that's received that designation. In the 4 years that the program has been open, we've done several hundred weight loss operations. Our volume is usually somewhere between 125 to 175 cases per year. We keep track of how much weight has been lost. It's been about 10,000 pounds per year as well. In addition to that, we've seen countless patients who have been cured of their weight-related health problems like diabetes or high blood pressure. And one of the very satisfying parts of having a program like this in a state like Wyoming, we actually get to see the results of the people that we've been helping, and it's been very satisfying to watch, patients come in, they go through the process, they lose a bunch of weight, and their health problems just melt away. And we've seen a lot of that since the program has begun. I like to discuss early on in this presentation what the word obesity means, because a lot of people attach sort of a social connotation to the word obesity that's not always positive. But I like to point out early on that when we use the word obesity, we're using it as a medical term used to describe excess body fat. We view obesity as any other chronic disease, similar to hypertension, similar to diabetes. And basically, it means that your body's system that should be regulating your weight is not working correctly, and it leaves you at too high of a weight. The analogy that we like to use is that of a thermostat in a room. It's very similar. You set the temperature on the thermostat and that's where it stays. For obese patients, their weight thermostat is set too high. We use the body mass index to define obesity. And basically, this is a calculation that involves plugging in your weight and a height into a formula that spits out this number. If you're interested in knowing what your body mass index is, just type it into an internet search engine. They'll ask you your height and your weight, and they'll give you your number. From a medical standpoint, a normal body mass index is anything less than 25. You're considered medically overweight if you fall between 25 and 30. And then we start to use this term, morbid obesity, if your body mass index exceeds 30. Now we get to talking about weight loss surgery when it hits more the 35 to 40 range. Roughly speaking, a body mass index of 40 for the average height adult is approximately 100 pounds heavier than a person should be. Most patients, by the time that they are seeing me, have tried several efforts to lose weight in the past, specifically various fad diets or exercise programs. And in fact, that's one of the requirements if you're planning on proceeding with surgery, is that you've tried other things to lose weight in the past. But what we often see is what I call the vicious cycle of weight loss. People start out very motivated to lose weight. Perhaps they go on a diet or join a gym. And most people are successful initially as they do that. But as time goes on, life gets busy, they end up falling into their old habits, and most people will ultimately regain the weight that they lost. And in some situations, they actually end up heavier than where they started. We've been in medicine observing this phenomenon for years and years, but someone a couple of years ago in 2016 actually did a study looking at contestants from the TV show The Biggest Loser. And for those of you that are not familiar with that show, Basically, they had a group of obese people who were competing to lose the most weight, and they had all the resources available to them, from counselors to dietitians, personal trainers. And the researchers in this study followed up with all of those contestants for 6 years after surgery. And unfortunately, every single one of those contestants regained almost all of the weight that they lost when they had all of those added resources. So you may say, well, did they lose their willpower, or did they somehow become lazy? And we understand that that's not the case now. Obesity truly is a disease, and the regulation system in the body controlling your weight is not working. So what we see when a person loses all that weight on a diet or an exercise plan is that their metabolism slows down, their hunger goes up, their energy levels go down, all of that combating this weight loss. It'd be similar to if you were stranded alone on a desert island finding food. And so your body just works to preserve all the calories. And ultimately, most people will regain the weight that they've lost with those dietary and physical activity interventions. Surgery becomes an important factor for people because it allows us to reset that internal thermostat and lower that weight set point. And the difference between surgery and those diet plans is that surgery actually speeds up your metabolism, and it alters the hormone balance in such a way that your body realizes that it's overfed, and your metabolism goes up, your energy goes up, and you feel less hungry. And so that's the difference between the surgical intervention and the purely lifestyle changes. Obesity as a multifactorial disease is caused by genetic components, environmental components, lifestyle components. And with a complex multifactorial disease, we have to approach that from several different angles. So we treat obesity with a combination of diet, lifestyle, and surgery. Patients who go through with surgery, all of them work extensively with a dietitian, behavioral health professionals, their primary care providers, myself, and in many situations, other subspecialty physicians. And we combine our approaches to approach the disease of obesity in a comprehensive fashion so that we can treat it most effectively for the long term. Patients who are a good candidate for weight loss surgery first have to meet the body mass index criteria. We use the National Institute of Health criteria from 1991, which basically says that if your body mass index is above 35 and you have weight-related health problems like high blood pressure or diabetes, you qualify for surgery. If you don't have any of those health problems and your body mass index is 40, you qualify. And again, that indicates that you're about 100 pounds heavier than you ideally should be. Another very important criteria that we have to look at in deciding if you're a good candidate for surgery is that the benefits of surgery would outweigh the risks. We take care of patients with a broad variety of health problems, some of them quite severe. Most of those patients will ultimately be able to have surgery, but there are certain situations where a person is too sick to safely go through an operation, and that would be a reason to not do surgery. Another important factor is that patients are committed to their long-term success. What I mean when I say that is you have to view the weight loss surgery as a tool. There is no perfect cure for obesity. So for the rest of your life, whether you have surgery or not, you're going to have to eat a healthy, well-balanced diet. You're going to have to get some physical activity. And to qualify for surgery, you have to demonstrate that commitment to taking good care of yourself for the rest of your life. Some patients won't qualify for weight loss surgery. People who don't meet the body mass index criteria don't qualify for surgery. Other patients who have such severe health problems that they couldn't safely get through an operation don't qualify for surgery. Now that said, most patients, even with severe health problems, we're able to optimize their health problems in such a way that we can get them safely through surgery. Other reasons that we would hold off on surgery: if you have untreated psychiatric disease. That's not to say that if you carry a mental health diagnosis, you couldn't have surgery, but it has to be well treated, and you have to be well tied into the resources necessary to manage that before and after surgery. Patients who are actively abusing substances or illegal drugs are not good candidates for surgery. And the other piece, you have to quit smoking before surgery. And we'll help you do that, but certainly that has to occur before you would qualify for surgery. There are two primary weight loss operations that we do at Wyoming Medical Center, the gastric bypass and the sleeve gastrectomy. There are other weight loss operations that you would read about if you're doing research on the internet. Those are very rarely done, and it's really a rare patient that qualifies for those specific operations. That is something that we could definitely talk about on an individual basis with you as you visit with me in preparation for weight loss surgery. We also offer revisions of previous weight loss operations when it's medically appropriate. One of the major advantages of weight loss surgery now as compared to the past is that we do all of these operations laparoscopically, or through the use of keyhole incisions, very tiny incisions on the outside of your body. We're able to accomplish the entire operation that way. The recovery with laparoscopic surgery is dramatically easier and faster than it would be with the open operations the way that it used to be done. Gastric bypass is the oldest and most trusted weight loss operation that we have. The first one of these was done in 1967, so we have over 50 years of experience with the gastric bypass. Essentially, this operation involves the partitioning of the stomach to create a small stomach pouch and a rerouting of the small bowel to attach to that pouch. The gastric bypass works in several different ways. First, by partitioning the stomach is quite a bit smaller, so you feel full very quickly when you're eating. Second part is that you don't absorb all the fats and nutrients from the food that you eat because we've bypassed the first part of your stomach. And then finally, and most importantly, the gastric bypass changes the hormone balance within your body to allow you to feel that sense of fullness and decrease hunger. The gastric bypass works in several ways. First, by making the stomach so much smaller, it gets full quicker, so you're not able to tolerate as much food. And secondly, by bypassing that bigger part of the stomach and the first portion of the small bowel, you don't actually absorb all of the fats and nutrients from the food that you eat, so it's somewhat malabsorptive. And finally, the gastric bypass changes the hormone balance within your body to make you feel full quicker, speed up your metabolism, and decrease your feelings of hunger. The gastric bypass is considered the gold standard weight loss operation by many because it's been around for so long. Whenever a new technology comes along, we always compare the outcomes of that new thing to the gastric bypass. One of the reasons why the gastric bypass has persisted for so long is because it is so effective at both weight loss, but also at helping to treat the weight-related health problems. One of the best examples of this is of type 2 diabetes. And it's very common for a patient to come in, have their surgery as a diabetic, they're taking medications or insulin, and they go home from the hospital a day or two later with normal blood sugar, no longer requiring any medications. And the reason why that happens is because of the profound hormonal changes that occur as a result of the gastric bypass. That's a very good example of a health condition that gets better almost immediately after a gastric bypass. Another health condition that tends to resolve very quickly is that of acid reflux, a very common problem in our world. Patients who suffer from acid reflux tend to get better very quickly after a gastric bypass as well. In fact, the gastric bypass is the most effective treatment we have for acid reflux in patients who are heavy, more effective than any medications. And so that's a big draw to the bypass as well. Basically, we see with any number of health conditions, they just get better after the gastric bypass. The other weight loss operation that's most commonly done is a sleeve gastrectomy. In fact, this is the most popular weight loss operation in the world today. A sleeve gastrectomy involves the removal of the outer 80 to 85% of the stomach, leaving behind a thin sliver of stomach that takes on the shape of a banana. Someone along the way early on thought it looked like a shirt sleeve, so that's how it got its name. I do like to point that out because when people hear the word sleeve gastrectomy, often they think that we're inserting some sort of plastic sleeve or there's a foreign object implanted, but I like to be very clear that that's not the case. It's all your body's own natural tissue. It just takes on the shape of a sleeve. The sleeve gastrectomy works in two ways. Number one, the stomach is so much smaller that it just doesn't hold as much food and drink, so again, you feel full very quickly. The other interesting way that it works is that One of the hormones that your body produces that makes you feel hungry is primarily produced in that piece of stomach that we remove. So when we take that stomach out, the stimulus for feeling hungry is greatly reduced, in addition to having such a smaller stomach that you can't eat as much. The sleeve gastrectomy is very effective for weight loss. When compared to the gastric bypass, we believe it's slightly less effective in terms of overall weight loss, but nevertheless, patients tend to lose a great deal of weight after a sleeve gastrectomy as well. The main advantages of the sleeve gastrectomy are that it's a much quicker, simpler operation. As a simpler operation, the risk of certain complications is lower with the sleeve gastrectomy. This is particularly useful in patients who've had a number of other belly operations. If they have a lot of scar tissue in their belly, a sleeve is often a good choice because we're able to safely accomplish that surgery without putting the patient through additional risk. The decision as to whether you'd have a gastric bypass or a sleeve gastrectomy is a very individual decision, and we make that decision together after going over in detail your own personal health history, your own personal goals, and together we decide which operation is most appropriate for each individual patient. This is one of those situations in medicine where patient preference plays a large factor as well. Many patients that I see have a family member or a friend who've had one operation or the other, and it's led them to strongly desire that. And most of the time we're able to work with those requests. Every patient that goes through surgery undergoes an extensive preoperative preparation process for the operation. Everyone will meet with a registered dietitian for dietary counseling. Some people will meet several times with them. Everyone meets with a behavioral health professional. I also do some specific testing prior to weight loss surgery. We draw blood work, for example. I perform an upper endoscopy on everyone prior to surgery to evaluate the health of the esophagus and the stomach. But in patients who decide that they want to go through with surgery, essentially we work them through the preoperative process and prepare them for surgery in that way. In terms of when you would have your surgery, from the day that you first meet me to the day of your surgery, oftentimes is directed by preoperative insurance requirements. Every person's individual insurance plan is different. At this point, we've worked with just about every type of insurance carrier, but staff from my office and from the Wyoming Medical Center will help determine what your preoperative requirements will be, and we help you get through all of that. The whole process starts by meeting with me in my office, and I will connect you with all the other resources you need to prepare for weight loss surgery, including a dietitian, behavioral health professional, and any subspecialty physicians that you'd have to see as well. As part of the preparation for surgery, every patient is placed on a special diet for about 2 weeks prior to surgery. We call it the liver shrinking diet. And basically, it's a very high protein diet intended to shrink the size of the liver. You may or may not know that the left lobe of the liver sits basically right on top of the stomach in the abdominal cavity, and we have to retract the liver out of the way to safely get to the top of the stomach. And by participating in this preoperative diet, it shrinks the size of the liver and actually makes it a lot safer and easier to do the operations. Following surgery, you're on a liquid diet as well for about 2 weeks. During your visit with the registered dietitian, they will go over all of the details of the pre- and post-operative diet with you. But essentially it starts with a 2-week liquid diet followed by a gradual progression back to regular food. Most patients are eating the full spectrum of regular food by about 3 to 4 months after their surgery. Most patients are able to leave the hospital 1 to 2 days after the operation. Again, because we do these operations laparoscopically, the recovery is very quick. Most patients would expect to be on pain medicine for just 1 to 2 days after surgery, and they go home to recover. The average person will be off of work for anywhere from 2 to 4 weeks. People who have jobs that require them to do a significant amount of heavy lifting tend to need to wait a full 4 weeks to return to work. That said, most patients are feeling energetic and well enough to return to work within about 2 weeks. It's It's very important that if you are currently a smoker that you're able to quit before surgery. We require you to be quit for a full 6 weeks prior to surgery. Now, as a physician, I'm always going to advise a patient to quit smoking, but it actually has been specifically studied as it pertains to weight loss surgery. And people who smoke around the time of surgery have a 5 times increased risk of a major complication. So it's very important that you quit. This includes any nicotine substitutes or vaping products. The silver lining to this is that after surgery, you really do get to start a new chapter of your life, a healthier chapter, a thinner chapter, and to get rid of the smoking to go along with that is a really nice way to be the healthiest person you can be. There are certain other health conditions that we like to really optimize before a patient undergoes surgery. One example of that is type 2 diabetes. We know that if we can get your blood sugar under good control prior to surgery, you're going to heal up much better from surgery, and your risk of a complication will be reduced drastically. For those diabetic patients out there, we shoot for a hemoglobin A1C below 7 at the time of surgery. And we will work with you, your primary care provider, in some situations an endocrinologist to help you accomplish that goal. But we view that as very important, and it is a key component to your success after surgery. Other health conditions like obstructive sleep apnea are very common and also frequently go undiagnosed. So many patients, if you have any risk for obstructive sleep apnea, will do the testing to see if you have that and begin treatment before surgery as well, knowing again that that will help you to get through surgery in a more safe fashion. Many patients ask me when they can start their exercise regimen after surgery. You can start with light cardiovascular activity. Even the day of surgery, we get you up walking. But when you go home, I'd like you to be up and about as much as you can be. You can go up and down stairs. You could do some light cardiovascular activity immediately after surgery. The only real restriction that we have is that you're not allowed to lift anything heavier than 20 pounds for about a month after surgery. At first, you'll be too sore to lift heavy items, but the main point of that is that I don't want you to develop a hernia at one of your little tiny incision sites, and to avoid heavy lifting is able to prevent that for most people. Another question that patients often ask is when they can drink alcohol, and it's important that we discuss that a little bit here today. Patients have a higher risk after surgery of developing alcohol abuse, and we have to be very cautious to avoid that risk for each person. At a bare minimum, we ask you to abstain from alcohol for 6 to 12 months following your surgery. You have to be aware that when you do drink alcohol after surgery, things are different. Your GI tract doesn't work the same. So many patients would notice that alcohol has a much stronger effect on them. Where it took a drink or two to get a light buzz, it may take a sip or two to get a light buzz after surgery. And to go along with that, that can promote unhealthy drinking behaviors. The other concern that we have is that people can suffer from something called addiction transfer. And a very common phenomenon for patients who are obese is that some of them are addicted to food. And if suddenly you're no longer able to eat the same types and amount of food that you were beforehand, some patients will transfer that addiction to alcohol. And statistically speaking, the risk of developing alcoholism is higher after weight loss surgery than if you didn't have it. That said, we know that this is the fact, and we advise patients to hold off on any alcohol consumption for a full 6 to 12 months after surgery. Most insurance plans do cover surgery. We do participate in Medicare and Medicaid, both of whom also cover surgery. Each plan has a different set of preoperative criteria that a patient has to meet. And again, my office will help to sort out specifically for you what the criteria are, and we'll get you tied into whatever resources we need to accomplish the preoperative requirements that insurance demands. If you have any questions about the finances regarding weight loss surgery, you can call one of Wyoming Medical Center's financial counselors. One of the most common questions I'm asked is, what about all of the extra skin that a person has after they've lost all their weight? And what I tell people is that we need you to wait at least 12 to 18 months after surgery before thinking about having skin removal. A board-certified plastic surgeon is the provider that would take care of any excess skin removal, and we have great plastic surgery services here at Wyoming Medical Center. One of the reasons to have surgery is to improve fertility. It works really well for that. And we have patients wait about 12 months after their surgery before we would want them to get pregnant. We have to be extra careful there because fertility does improve very quickly after surgery, so precautions need to be taken to make sure that you don't get pregnant within that first year after surgery. Most patients after surgery find that their energy level increases dramatically. It is also a great relief to people when suddenly they don't have to take a bunch of medications when they get up in the morning as their health conditions have improved. In many cases, patients just get their life back and they're able to do the things that they always wanted to do but were not able to before. People improve in all kinds of ways after surgery. I've had numerous couples come in that have been suffering from infertility. They just couldn't get pregnant. One or both of them have had the surgery and they've been able to have kids, and that's a very satisfying thing. I've had big, tough coal miners who are in tears because they could play soccer with their kid for the first time ever. They weren't able to do that before. One of the most enjoyable parts for me as someone who grew up in Casper, Wyoming, has been to return to my hometown to start this practice of bariatric surgery. And I've been very pleased with how just the high level of care that we're able to provide at Wyoming Medical Center. One of the reasons why there are no other accredited weight loss surgery programs in the state is that it's complex. We have to have resources in place, including a variety of subspecialty physicians, nurses with special training, and we have all of that here, and it's been just a pleasure to come back to Casper, to work at Wyoming Medical Center, and to watch this bariatric surgery program grow into one of the more successful programs I've ever seen. And I think the local community of Casper has embraced this. The hospital has embraced it and has just done really well with integrating this new procedure into the community. Here at Wyoming Medical Center, we have an outstanding team involved in the care of the weight loss surgery patients. From the outpatient and inpatient dietitians, to the local mental health providers, to the nurses, anesthesiologists, billing staff, everyone on our team is committed to your success and is excited to see you go through this process.